All right, as I mentioned, I want to get to the three most contentious issues of the debate. If we can try to get to it all, we're going to try. There's obviously a lot more to discuss even than just this. The first issue has to do with funding. How do you fund reform? It's going to be expensive, $50 million without health care insurance, a price tag of around $1 trillion to be able to do that. I want to bring in Charlie Rangel, Congressman of New York, of course, Chairman of the House Ways and Means Committee. Congressman, welcome. I want to take you to Montana. This was the town hall debate that the president had, and listen to Randy Raffy, what he had to say.
Max Baucus, our senator, has been locked up in a dark room there for months now, trying to come up with some money to pay for these programs. Right. And we keep getting the bull. That's all we get is bull. You can't tell us how you're going to pay for this. You're saving here, you're saving over there, you're going to take a little money here, you're going to take a little money there, but you have no money. The only way you're going to get that money is to raise our taxes. You said you wouldn't. Max Baucus says he doesn't want to put a bill out that will, but that's the only way you can do that.
Congressman, isn't he right?
I can't believe that our democracy is so fragile that people who have no answer to a very serious problem would just try to create animosity and hatred rather than to sit down and first find out what is the problem, how costly is it, and then what does it take in order to stop it. There's no question that most everyone listening to this show have known some horrible story where someone has lost their home, their job, as a result of not being able to cope with the cost of present health care. And it's getting worse, and more people are losing health insurance, and the people who have it don't have it. We're going to have to pay for it, but it's going to be less in doing something right now than if we just let these things turn over to people.
Okay, but how are you going to pay for it?
Scripts.
You're for a surtax on the wealthy. Is that going to work in the Senate, Congressman?
First of all, when we start talking about how you pay for it, you got to stop the hemorrhage, and we can do that. Much of the things that we're doing out there, that's the cause of the problem that we're in, can be taken care of by having the right procedures given to the right people and making certain that we cut down health care. And when the people of the industry can tell you that they can save tens of trillions of dollars by working with the president, then you know that we can resolve most of this by stopping what we're doing wrong.
But Congressman,
and yes, it does take some money.
All right, but I want to focus on that.
It does take some money to kick this off.
Congressman, my question to you is whether the surtax, wait a minute, Congressman, can the surtax survive in the Senate? You want to raise $544 billion of this price tag through a surtax on the wealthy. Can that prevail in the Senate?
I don't know what can prevail in the Senate. All I know is this, that people are trying to use hatred as a substitute for discussion. We should be talking about how much does it cost? Is it costing too much? What is the Senate going to do? What is the House going to do? Well, when people are paid to work up our town hall meetings, it's clear they're not looking for a solution. They're looking for a political out of this serious question.
Congressman,
so we should be talking with the Senate. We should be talking with them now. They don't even have a bill.
Congressman, if you look at the longer-term picture here, beyond 2019, the 10-year window for this plan, the Congressional Budget Office has said that health care costs will go up at such a rate that proposed tax increases and other savings cannot keep pace, and that the deficit will rise. Can the president keep his promise to not raise taxes on those making $250,000 or less?
Yes, he can, and he will. The problem that we have is what do you score? What does the Congressional Budget Office count as being a savings? Is it people, what happened to the last few years of someone's life? Is it the overcharging that pharmaceuticals and doctors have? Is it the number of people that go in and out of hospitals and we don't reward those who do the right thing? These are questions we should be talking about. But what is happening now is a building up of hatred. And I am so surprised that our churches and our synagogues and our mosques are not coming here and saying that want the right thing done by poor folks who can't afford health care, working people that don't have health care and should have it, and people who do have health plans that really are hemorrhaging in increases in costs. This is not a Republican or Democratic issue. This is an American humane issue, and we're not dealing with it with these type of town hall meetings.
Congressman Rangel, always good to have you. Thank you very much for joining the discussion.